Welcome back. So the health sector has been under the spotlight for all the wrong reasons over the past year. Health unions have repeatedly threatened to go on strike, citing poor working conditions. Some hospitals have been operating without essential supplies, and there's a plan by the Ministry of Health to replace NHIF. Baldin Waliaula gives a diagnosis of the state of healthcare in Kenya Kwanza's first year in power.
1 year after Kenya Kwanza took the reins of power, the health sector is grappling with various serious challenges. The tenure started with a corruption scandal at KEMSA involving treated mosquito nets. This was followed by allegations of hospitals siphoning funds from NHIF, threats of strikes from medical unions, and complaints from healthcare workers about their working conditions.
Cost of medicine, the cost of drug, the cost of accessing care is making families to sell properties and to remain much poorer. On the matter of health workforce shortages, the shortages of healthcare professionals, including doctors, clinical officers, and nurses, is a passive issue that continues to undermine the effective delivery of services.
President William Ruto and Health CS Susan Nakumicha have actively been pursuing the recruitment of 100,000 health promoters to lead primary healthcare efforts and realize the dream of universal health coverage.
Kuanzia mwezi wa saba, 1 month away, sisi kama national government, serikali prioritize, and we are going to do a matching fund for community health promoters. Whatever the county is giving you, we are going to match that figure so that pia nyinyi mkuwe na kitu mzuri kwa mfuko kama community health promoters. And we have recruited 100,000 community health promoters to ensure that each community health promoter takes care of 100 households in Kenya.
Healthcare professionals argue that hospitals should be adequately equipped with supplies and the necessary human resources before the recruitment of health promoters.
The work of health promoters is promotion of health, is sensitizing the communities so that they can improve the health-seeking behavior. Once they do that, you are going to see more people, more patients coming into health facilities. But when they come there, they are going to find there are no health workers to see them. They are going to meet long queues, and with time, I can assure you, that sensitization, whatever they'll have achieved, it will be null.
In a bid to ensure UHC, the government plans to repeal the NHIF Act and replace it with 3 new laws. The Ministry of Health has introduced the Facilities Improvement Financing Bill, Digital Health Bill, and Social Insurance Bill. These bills are currently undergoing public participation, and should they become law, the 3 funds will be managed under one umbrella, the Social Insurance Authority.
The new funds you are seeing, one is that they are not 3 new, NHIFs kind of things. So this is one social health authority, and this social health authority is looking at the whole landscape of healthcare financing. And what are we saying? In the past, we have seen that NHIF has only been covering largely higher level facilities, and therefore the incentivization is for you to go to higher level facilities. But we should have a social insurance or social authority that is ideally taking care of lower level facilities, so that people are able to go and seek services there.
How do these 3 funds differ from the current NHIF, and how will they benefit Kenyans?
So when you go to these facilities of this level, which are providing primary healthcare services, you will provide a card. They will give you a service. You provide a card. They will charge the card the same way NHIF charge for higher level facilities. They will charge that card for the services provided, and that money will go to that facility.
Okay.
So that facility have money to be able to improve its own services.
Economists have expressed concerns that establishing a new authority will be costly to the taxpayers.
In my opinion, the Kenya Kwanza government must have some quick wins to get our trust and believe that they are doing what they put in the manifesto. And health is one of them. So I see them putting a lot of effort to making sure that those bills go through. My only concern is how they are going to make sure that as many Kenyans as possible pay to this health insurance scheme. Because the more people pay, the cheaper it becomes for all of us. But again, at the end of the day, people want to see results. Once people see results.
Proponents of the new bills argue that they will ensure that all Kenyans have access to primary health care, which will be free of charge, ultimately leading to the realization of universal health coverage.
The NHIF we have now is an old colonial outfit that ideally have focused for many years on the employed people. These employed people are 20% of Kenyans. So even if they were to be charged almost all their salary, it will be next to impossible for them to actually fund the healthcare of the 80 who are out there. Mm-hmm. And therefore, we must come up with a social insurance that is talking about the center of it is actually the 80. Mm-hmm. The 20 are, they are the minority, so to speak.
Belden Waliaula, KTN News.